Hi, everyone. For those who have just joined, this is the official side event of CPHIA, run by AfroPHC Youth Hub. As mentioned, I'm Dr. Kapil Narain. I'll be serving as a co-moderator for the session. I'm going to introduce my fellow co-moderator, Dr. Mary Claire, who is an amazing individual from Kenya. So Mary Claire is one of Africa's upcoming leaders who has played an active role in advocating for meaningful youth engagement in various healthcare spaces, leadership and governance-wise through her experience in multiple youth-led organizations. Some organizations which she served in the past include IMSACE, IFMSA, and Incision. Her interest lies in advocating for universal health coverage and human rights. And this has seen her be vocal on the side of vaccine equity in Africa and take part in campaign efforts such as the hashtag Stop Playing Games campaign and the hashtag VaxTime initiative, amongst many others. She currently is serving as a 2021 executive board member of the African Forum for Primary Health Care, which is AfroPHC, an organization whose mission is to bring together the leadership of healthcare workers at the coalface in primary health. Furthermore, she's a practicing medical doctor serving at the front lines in Kenya. Welcome, MC.
Thank you, Kapil. Happy to be here and happy to have all of you amazing African youth on board. So allow me to also introduce you, Kapil. So Kapil Narain is a frontline healthcare worker based in South Africa, as he earlier introduced himself. He's also a multi-award winning youth leader, One Young World ambassador, and activist from Durban, South Africa. He serves on the advisory board of the African Forum for Primary Health Care, which normally champions for universal health coverage, as well as being the deputy chair of Active Citizens Movement and serves on the executive board of the Africa Healthcare Students Summit. He has served as a member of the African Youth Front, which was an initiative of the African Union and the Africa CDC, of the COVID-19 technical working group at FAMSA, which is the Federation of African Medical Students. In 2020, he was named one of Mail and Guardian's top 200 young South Africans, where he was the youngest in the health category. He's also a recipient of the prestigious A. Bailey Travel Bursary in 2019, which enabled him meet leaders from the African Union, London, Oxford, Cambridge, and Edinburgh universities. And he's also passionate about academia and has several publications in peer-reviewed journals. His desire for activism includes leading initiatives tackling stigma around TB, HIV, and mental health, and convening a march for gender equality, raising awareness about the challenges of a frontliner in the waves of the COVID-19 pandemic, as well as co-organizing the VaxTime campaign, which aims to combat misinformation and improve vaccine uptake. That's quite a stellar bio, Kapil. You're doing amazing work in South Africa and keep up the good work. So I think I'll hand over to you, Kapil, just to introduce our first, we're having a partner presentation for starters. So I'll hand over to Kapil to introduce our partners from the Africa Leaders Malaria Alliance Youth Advisory Council, and then we can get this show started. Over to you, Kapil.
Thanks, MC, for the generous introduction. So we're having a fireside, a brief presentation by ALMA, which is the African Leaders Malaria Alliance, an intergovernmental organization whose aims is dedicated towards ending malaria deaths, and which has become operational during the 64th United Nations General Assembly in 2009. It's a groundbreaking coalition of 49 African heads of state. So I'm going to hand over to them so that they can provide a brief presentation on this.
Hello, Kapil.
Hi, Alois.
Yes, I feel like I cannot switch on my video.
Try again.
Okay. Yeah. So good morning, good afternoon, good evening from different parts of Africa. My name is Alois Oloresa. I'm a chairperson of the ALMA Youth Advisory Council, as introduced, and it's really my pleasure joining you in this meeting. And my pleasure meeting you from different parts of Africa, doing amazing works. Those of Kapil, Dr. Mary Claire, and many others were in this panel, and those and many other participants in this very important session alongside uh, the larger conference. So as introduced, ALMA is a coalition of not 49 but 55 African heads of states in the fight against malaria, established under the African Union since 2009, and currently being chaired by His Excellency President Uhuru Kenyatta, the President of the Republic of Kenya, and who has a top four legacy agendas. And one of the agenda is digitalization and real-time data. The second agenda is the sub-regional coordination. The third agenda is the End Malaria Councils and Funds. And the fourth agenda, which the Youth Advisory Council capitalizes on, is the Malaria Youth Army. The aim of this agenda and legacy agenda of His Excellency President Uhuru Kenyatta is to recruit a new generation of malaria advocates to champion political and resource commitments to support malaria control and elimination, as well as improving health outcomes in Africa. The Youth Army serves as champions for the universal health coverage agenda and malaria elimination in their countries and at the regional level. So in line with His Excellency President Uhuru Kenyatta vision, as explained, to establish the Youth Army to increase participation of the youth and harness Africa's demographic dividend in the fight against malaria. The ALMA established a Youth Advisory Council, which I serve as a chairperson, and we have other 10 members of the council from each region of Africa, including the diaspora, the youth in the diaspora, so that to ensure equal representation of African youth. The role of this council is to provide strategic guidance to the youth armies at country levels and regional level and continental level, as well as advocating for meaningful youth engagement in the area of health, particularly in the fight against malaria. The Youth Council has been doing different activities, Pan-African activities, and we have been engaging with several ambassadors from the African Union and many other African countries to champion and to reinvigorate the fight against malaria and promote universal health coverage. The rationale of this having the Malaria Youth Armies is, first of all, what I explained earlier, the ALMA Chairs Youth Agenda, the untapped potentials of the African youth, that's from the AU agenda, that we believe that young Africans, young people have a lot of potentials which remains untapped. And this is proved by even organizations such as AfroPHC, which is championing for youth engagement. And in this important session where we're discussing the role of youth in the fight in promoting PHC during COVID-19. This is a demonstration of a lot of potentials that exist within young people. Having young people like yourself, Kapil, and many other who are the panelists in this, it's just a proof that young people in Africa have a lot of potentials which needs to be tapped or unleashed to accelerate the agenda of promoting health across Africa. But another point is the impact of malaria burden on youth, that we have seen malaria contributing to a lot of deaths, and currently in every minute a child under the age of 5 dies of malaria. This is a real burden to the world and our communities, that we are using a lot of manpower, you're losing a lot of people and we are posing a lot of risk to the next generation. So we saw that malaria has a lot of other social and economic impacts to the current generation, especially the young people. And hence the Youth Council is championing to ensure that young people come up and take up their energy to ensure that we end malaria. And also engaging young people in SDGs and health agenda makes sustainability in work. That means young people are not only the future generation, but the present. So by engaging, by ensuring that young people are meaningfully engaged, we believe that sustainability will really be achieved. But also post-COVID-19 recovery agenda, like when we're engaging young people, we are adding up energy to building back better. So the aim of this youth army is to build a social movement to fight malaria, improve maternal and child health, and improve access to universal health coverage. The overall objective is to advocate and drive action towards malaria elimination and expansion of the UHC agenda in Africa. Some of the specific objectives that we have, one is advocacy, that is to advocate for police action and resource mobilization to end malaria and promote UHC. Another area is communication for change, and believing that young people can support awareness raising in the communities, sensitization activities, and dissemination of important messages, but also community engagement and innovation. So to go quickly, that some of opportunities that we have in the Youth Advisory Council is training opportunities for young people. We have this scorecard training. The scorecard is a digital tool for malaria data. We train young people to access important information, not only in malaria, but in other areas of health, such as neglected tropical diseases and maternal and child health, as well as adolescent health. So these scorecards are important data tools to provide more information for young advocates to have information-based messages and advocacy activities at the community level. We have been training young people, and currently we have trained 120 young people in Africa in the areas of innovation, and 2,000 young people, 2,000 more young people from 38 African countries in the area of universal health coverage and malaria elimination, as well as health systems strengthening. So we have more opportunities for trainings, and we look forward to collaborations from youth-led organizations such as the AfroPHC, and we have FAMSA, we have IFMSA, and many other youth-led organizations that are willing to accelerate the agenda of youth, strengthening youth engagement in the area of the fight against malaria. So for this short time, let me end there and wish you a good discussion in this as we accelerate the agenda of youth engagement at continental level. Thank you.
Thanks very much for that fireside presentation and showcasing the great work that's been done across the continent, tackling malaria, which is a grave challenge, as we know, one of the major infectious diseases that still plague the continent. I'm going to hand over now to my co-moderator, MC, and she'll take us through. Thank you.
Thank you so much, Kapil, and thank you so much, Alois. We're always happy to have allies in our quest for attaining primary healthcare in the region, especially as youth. And we welcome you to stay on in the session, and possibly we might have a couple of questions on how ALMA ties into our theme for today. So next up, we are going to have an interlude before we jump into the discussion of the morning. And this will be in form of a poem by one of our panelists. His name is Daniel Otobo, Dr. Daniel Otobo. I'll call him Dr. Daniel Otobo because he's steps away from being a medical doctor, and he's interested in improving availability and access to primary essential care in the fields of reproductive health, surgery, emergency, and infection medicine, especially to the rural communities in Africa. And he is a multi-award winning and widely published scientific researcher and holds about 5 international fellowships. He's currently the chair of the Africa Healthcare Students Summit, as well as a vice president of the International Student Surgical Network in Nigeria. And in addition, he is part of the executive coordination team of the African Forum for Primary Healthcare, and he is proud to call himself an African. So welcome, Otobo, for your interlude.
Thank you so much, and please permission to share my screen. Okay. Thank you so much for the opportunity to present this poem. Now, the title of this piece is I Can't Breathe. Here in our hospital room, laid, her smile of Barbados, her hair of ivory, and her eyes of flames. She and not this oxygen kept me breathing. But right now, I do not understand why her machines have gone silent, and with it, her smile of Barbados and her eyes of flames. Why the many injections, the shock pads on her chest and the tubes in her throat? Why then now lays this sheet above her head, hiding a hair of ivory? Why her hands now dangle on it, our engagement ring? Why I now sense the voices surrounding me as I watch this shocking event, the injections in me and the shock pads now on me. Oh, I see. I can't breathe. As my heart failed just merely watching her get resuscitated, she was my home, my past, my present, and my future, moi Africa. So, reaching out, I asked the doctor, Nini Kimetokia, what happened? The doctor said she was suffocating from the health inequity and indignity that her people had to pass through due to their identity. She was choking from the smokes of unclear tales and false information of her pandemic turning into a pandemonium. She was dehydrated by lack of satisfying advocacies and awareness to quench the thirst of the undue mass ignorance. She was hypovolemic, not because of the corona pandemic in her, but because of the negligence epidemic in her veins. She was pale, and no one transfused her. She was febrile, and no one cooled her fever. She was jaundiced, and we called it culture and diversity. And now, Africa can't breathe. Who's going to employ the ABCs of resuscitation on her? Compress and ambulate oxygen into her lungs, inject hope as an antidote into her veins. Who's going to quench the thirst of factual information to the masses, bring the good news of primary health care to the communities, and clear the fumes of fear for lack of neighborhood health care friends? Oh, as we live and breathe, we are Africans and not Africans. We are the future of Africa, and Africa is my home and your home. We are not going to watch as Africa suffocates. We can't. Now, let's help Africa breathe again. Thank you so much.
Wow, amazing. We are Africa and not Africans. It's quite, I think that's the best analogy we could use, especially with this pandemic, how we cannot breathe because of all the various gaps that we have in our various healthcare systems. Thank you so much for sharing that key message. And we will also share the poem with those who are with us. So without further ado, I think now we have reached the time of the most important discussion, and we will be starting off our session. So I think I'll hand over to Kapil to probably do us a small overview on this discussion that we're having this morning before we introduce the rest of our panel.
All right. Thank you, MC. And such a powerful poem, Brother Otobo, that really speaks to the challenges that we face. Um, Thank you for that eloquence there. So with regards to the rest of the session, we're now getting into the meat of the discussion, which is the panel discussion. And the way it's going to run is I and MC, I'm going to introduce a panelist. The panelists will provide a short opening statement of about 2 to 3 minutes on primary healthcare and the involvement of youth in the pandemic. And thereafter, we'd pose questions to the panelists, and the panelists would then discuss this with the audience, with us, and with each other. And we'll let the discussion grow. We want this to be as flexible and energetic as possible. And thereafter, we'd then have a session for Q&A. So please do, throughout the Zoom meeting, do pop your questions in that, and we'd address them once we get to that segment. And thereafter, we'd have a minute each to each speaker for brief concluding remarks. Thank you. So I'm going to hand over to MC to introduce the speaker, each panelist, and opening statements thereafter. Thank you.
Fantastic. Thanks, Kapil. So our first panelist is Mr. Mohamed Isa. He is a sixth-year medical student from Alexandria, Egypt. During his years of medical school, Mohamed discovered that he has a passion. His passion was not just for clinical medicine, but also public health. He believes in the importance of public health in ensuring healthier communities built upon health equity and not health disparities. He has been volunteering in the public health field for the past 4 years and is currently holding the position of the liaison officer for public health issues for the 2021-2022 mandate at the International Federation of Medical Students Associations, as a youth leadership board member at the Global Youth Coalition for Road Safety. Mohamed's experience focuses on different global health issues such as non-communicable diseases, antimicrobial resistance, mental health, health systems, universal health coverage, climate change, road safety, and much more. Welcome, Mohamed.
Yes, thank you so much for the introduction, and thank you so much for having me in this session. I believe it's very important to focus on the primary healthcare, as primary healthcare is an approach to healthcare provision centered on the needs and circumstances of individuals, families, and communities. And it addresses comprehensive and interrelated physical, mental, and social health and well-being, while covering a breadth of services that include prevention, treatment, rehabilitation, and palliative care. This emphasizes the need for primary healthcare in our healthcare systems and in our road of achieving the sustainable development goals and achieving universal health coverage. And this cannot just be achieved by a certain target group or a certain sector or a certain stakeholder. It must be achieved by everyone using a whole of society approach. It must be achieved using a multidisciplinary and intersectoral approach in which everyone is involved, all healthcare professionals are involved, and more importantly, in our case here, youth are involved. Because youth represent the biggest demographic on earth. They represent the future of this generation and generations to come. And it's very important for us to empower each other and to develop our capacities in order to contribute to the primary healthcare. And in terms of the COVID-19 pandemic, it's very also important to learn from the lessons that we have achieved or we have encountered during the COVID-19 pandemic. We have seen how weak many health systems are. We have seen how fragile the governance in many countries are, and we have seen how we are vulnerable in terms of the pandemic and in terms of health emergencies. And this could have been better addressed. This could have been better addressed using primary healthcare or in the presence of strong primary healthcare approaches in different countries. So it's very much important to focus on this. While working under the umbrella of the 6 building blocks of the health systems: leadership and governance, service delivery, health workforce, health information systems, access to essential medicines and technologies, and last but not least, health financing. All of these are different aspects. All of these are different sectors that need to be worked on in order to ensure that primary healthcare is actually like something comprehensive, something accessible, and something that is focused on the community and its needs. This is, or like the presence of strong primary healthcare will allow us to meet the health needs of individuals throughout their life course, ensuring that healthy aging and healthy approach to our life course is achieved so that no one is actually left behind. And this statement should not be just a rhetorical statement that we are repeating, but rather actions that could be implemented, as I mentioned, using lessons learned, and at the same time ensuring that the primary healthcare, which is the first contact between the individuals and the healthcare systems, is a strong contact, is a resilient contact, is a contact that can provide them with all their needs and can address all their needs, all their issues, all their mental, physical, and social well-being issues, and ensuring that everyone, as I mentioned, and as Marie-Claire mentioned in my bio earlier, that health equity is actually achieved using these lessons and using primary healthcare, rather than health disparities being more apparent due to the different social, economic, commercial, environmental, and political determinants of health in different countries and in different populations. Thank you.
Thank you very much for those powerful sentiments, Mohammed. It's a pleasure to have you on board. I'm now going to introduce the next panelist. Our next panelist is my sister from Cameroon, Dr. Pokum Fano Onella. She's a medical doctor from the Faculty of Health Sciences, University of Bure, Cameroon. She has a great interest in public health for the 21st century, global health, and medical education. She is the former director of SCOMA, the Standing Committee of Medical Education and Research, under the Cameroon Medical Students Association, of which she is also the current president. And she's the co-chair for Incision Cameroon, an organization that is focused on promoting global surgery. Also, she was an international delegate for the IFMSA Pre-World Health Assembly, which focuses on youth in global health, diplomacy, and leadership, and attended as a delegate the 73rd World Health Assembly in 2020. In her free time, she engages in personal development and mentoring young people. Welcome, Dr. Onella. You can have the floor for some opening statements. Thank you.
Thank you, everyone. It's my pleasure to be here. Thank you, Kapi. Thank you, Marie-Claire, and thank you all the speakers that have already enlightened us much about this topic of today. So, yes, about today's topic, the role of youth in the primary healthcare respect to COVID-19 responses. I first of all like to say that it is a very important topic, especially in this time where the world has shown to us that Africa has to be sustainable and also dependent on its domestic abilities. So in ensuring that sustainability, we have to also ask about the youth, because yesterday I've attended the section, we're talking about the government roles, we're talking about civil society role, NGO roles, importance of domestic investment. Today, I think it's also time for us to actually emphasize on when the youth has its own play when it comes to putting the new order of public health into Africa. So I want to first of all remind us that primary healthcare is the first level of contact with people taking action to improve health in a community. And people need, and we need to know that primary healthcare focuses around 3 areas: meeting people need for promotion, prevention, and protection. And we also have to know that when we talk of youth, since 1983, United Nations defined youth as people between 15 and 24 years old. That is since 1983. I want to ask us today, can we challenge that status quo, because it has been since 1983 that definition was made. Is it not time to propose about the revising of that definition? Because I think from 1985 to now, I think many things have changed. Maybe that age need to be redefined, and I think this can be one of the resolution of this our section. If Africa youth should be put within this age difference or this age frame. The second thing I want to say is that respect to our topic, I want to emphasize that in respect to Africa, we need to inform youth about the 2035 agenda. And we need to come together and make it happen. And when you look at the 20 priorities area of the agenda linked to the SDG, I have come out with four aspects of those priorities, which youth have an enormous role to play. I want to believe that COVID-19 has just unveiled to us the deficit of our health system, but we need to know that it rests on our responsibility to be resilient and to actually fill the deficit. Looking at those four priorities area out of the 20 from the 2063 agenda linked to SDG, the first aspect is high standard and quality of life and well-being. You know that COVID-19 has been distorting many people. The lifestyle of people has been disturbed. The youth has a role to play in health promotion, encourage people to know about mental health, COVID-19, and in the way you're going to improve the quality of life of people, even during the COVID-19. Don't leave the responsibility of health promotion just to the TV. It's our role to get into play. Then the second aspect is well-educated citizen. It is our role to advocate about youth to be involved in education processes. Our curriculum is lacking education. If you want to say, future doctors are medical students first. So if we identify that we are not educated on the things we are treating patients on, it's a problem. Many students are the one asking protocol on COVID-19 on the WhatsApp group on this thing because they don't have it. So I think our school, we need to ensure that we fight and we advocate for the quality education that will give us to be well equipped to address the COVID-19 pandemic. The third aspect is the capability for transformative leadership. Many youth today cannot even take their responsibility on their own to transform healthcare. Youth are so passive. We need transformative leadership in youth. We need youth that can take the responsibility for their own. We need youth that can also drag the young people, because if we want to initiate change, it starts from us. It starts from us. The change starts from us. If we cannot boldly put on our picture or on statue that we have taken a vaccine, we are doing this. This is not transformative. Transformative leadership is showing the example. Is showing the example by leading. I think youth in Africa have to carry on with transformative leadership. That's my third point. And the fourth point that is still from the 20 priorities I've able to take is engaging youth in empowerment and decision making. Youth has to be involved to be empowered to do the things they have to be doing. We need to have a lot of section on youth advocacy, their role into playing. They need to be taught on diplomacy. I would like to have forum like IFMSA is doing a pre-WHA that teach students over the world on diplomacy, global health policy. We need forum that is called Pre-Something of Africa, where we come together and teach policy advocacy channeled or targeted towards Africa. And this can be done with the collaboration of the WHO Regional Africa region. And lastly, we want to take Africa to the Africa we want, as it is said in the agenda. And this will demand participation of youth in decision making. We need more youth that can learn the policy processes and take part into decision making to champion the future of healthcare in Africa. So with that said, I want to thank you, everyone. I think I'm done. Thank you. I hope I've passed on my message and it's going to be channeled to those that I have to put into action. Thank you.
Thanks, Onela, for your energy there. So I'm going to, so we're going to grow and develop this discussion of transformation. It's very important. I'm just going to introduce our next panelist right now. So our next panelist is Amit Gamal Salam, who is from Egypt. He's the co-founder of ANNSI, which is the African Novel Nurses and Students Initiatives. He was an ICN official delegate in the World Health Assembly, the 72nd assembly that was held in Geneva, Switzerland, and the former GASN membership director, that's the Global Alliance, as well as the ENNSSA co-founder committee, a general coordinator and first president in 2009, a demonstrator at the Faculty of Nursing at MTI University. He was previously a nursing improvement team member, the Ministry of Health in Egypt. He's also a nursing educator in the Nursing School of the Egyptian Armed Forces and a clinical instructor at the International Medical Center. He's studying for his master's in nursing education at Helvin University. Ahmed is widely traveled. He's visited several African and non-African countries, including Ethiopia, Kenya, Oman, Eritrea, Spain, Jordan, Rwanda, Turkey, UAE, Germany, Lebanon, France, Qatar, Switzerland, Austria, Sudan, Italy, Saudi, and has met global health leaders and nursing leaders. That's quite a bio, Ahmed, and we welcome you to this platform to provide your opening statements. Thank you. Hi, Ahmed. All right, I think Ahmed is having some network connectivity issues. So MC, I'm going to hand over to you to introduce the next panelist, and Ahmed, we will come back to you.
Hello, can you hear me?
Oh, hi, Ahmed. Yes, we can.
Yes, I'm so sorry for some technical issues. Thank you so much for this introduction, and really thanks for organizing such very crucial topic. We need to talk and take some actions after this session. I appreciated my colleagues that spoke about primary healthcare in general, but in terms of advocacy for a profession that represent more than 50 to 60% of the healthcare profession is nursing. So let me little bit focusing on nursing role in primary healthcare, or the role of primary healthcare nurses, especially in COVID-19. Primary healthcare, from my point of view, is an exciting and fulfilling area for nurses and all healthcare workers to work in, and the opportunities to grow long-term relationship with patients and help people as well to manage their health within their own communities in general perspective of health. Like, not mention that primary healthcare is constantly evolving and offers opportunities to work in a wide variety of settings, and also to collaborate with a host of other health and social care providers. From my point of view, nursing and primary health care, they play a crucial role. Like, nursing role across primary health care can differ depending on the position, population, team. I visited many countries, and really I found many perspective of primary health care from nurses, but at the end of the situation or the health settings, they have common responsibilities across the primary health care. For example, like the health promotion, illness prevention, midwifery and antenatal and postnatal care, what else? Rehabilitation and palliation and palliative care, community development, population health and public health, education, research, advocacy. So many roles, even I think quality control, and so on. So this is a very crucial issue, the primary healthcare concept, especially in some African countries. During COVID-19, before I'm speaking about the role of youth, I need to speak the rights of youth. Youth needs to be supported, need to be protected physically and psychologically as well. Because if you remember last year in March 2020, when WHO announced that COVID-19 become a pandemic, so how much fear, how much anxious and anxiety level of the youth, especially like fresh graduated, that they feel that they need to be protected physically and psychologically as well. So I think to optimize and maximize the role of youth in primary healthcare settings, especially during COVID-19 or even post-COVID-19, we need to think, or we need to take some recommendations. How can we support the youth physically and psychologically as well? Because we are playing a crucial role. In some countries, they foster the graduation, and they allocated some students, medical and healthcare students, to support some healthcare settings because of the shortage, as you know. So we did a great job, even in volunteering activities. In terms of ANNSI, the African Novice Nurse and Student Initiative, we did some many training sessions and capacity building activities in terms of mental health and psychosocial support, because really they need that. So the conclusion of this statement, we need to, as we emphasizing the role of youth, we need as well to think how can we protect the youth physically and psychologically as well to maximize their potentials. Thank you so much, Kapil. The floor is yours.
Thank you so much for that contributions, Ahmed. Very important. I'm now going to hand over to MC to introduce Bidian.
All right. Thanks, Kapil. Just give me 1 minute. Yeah, thank you, Kapil. So our next speaker will be Bidian Okoth. So Bidian Okoth is a young leader and advocate based in Nairobi, Kenya. And he is the current chairperson of the Youth4UHC movement, which is housed under AMREF Health Africa, as well as being the project coordinator of a reproductive health program called Respect, which is a reproductive and sexual health program for Kenyan teenagers, which essentially is a social change program that aims to revolutionize the social reproductive health space in Kenya. So without further ado, I'd like to introduce Bidian to give us his fireside pitch.
Hello, I hope you can hear me. No. Yeah, I can see Kapil almost nodding, so I guess I can be heard. Yeah, my name is Bidian, as mentioned. I am here to, a member of the Youth Hub for AfroPHC. It's quite a new thing and very exciting thing to be a part of. And I'm here representing the Youth in Action and AMREF Health Africa. And we work majorly with capacity building and equipping young people from different organizations across Africa to be able to champion for UHC, and also most importantly to monitor some of the activities. So we've just been very keen with activities in Uganda as they are passing their health insurance bill. And in Kenya, the president of Kenya has had universal health coverage as one of the key components of his 4-5-year agenda. It's called the Big Four agenda. And we are working very closely to ensure that some of the things like sexual and reproductive health and rights are included in the health benefits package for UHC. On to the agenda for today. I think public healthcare is a whole society approach of healthcare, and it focuses away from health promotion, disease prevention, rehabilitation, and palliative care. And it's important to always remember that it's a huge range. It focuses away from health promotion to palliative care. And some of the important components of this one. Issues about multi-sectoral policies that needs to be created to facilitate public healthcare, which there's lots of components into that, from policies within the insurance providers, policies from national and county governments for countries that have that can act as promoters of access to public healthcare. It's important to also, there's also an issue about the integrating health service systems so that we can have a proper referral system in itself. Issues about, in that we also have access to medications, access to services in itself. And the one that I actually like focusing on as an important component of PHC is that engaging and empowering individuals, families, and communities to increase their social participation so that we can enhance their self-care and self-reliance. At the end, public healthcare needs to be as close as feasible to the people's everyday environment. It's almost close to saying putting healthcare into the hands of people. And in that, we need to be able to facilitate people so that they are able to self-care, they're able to self-rely on themselves for healthcare. This goes hand in hand with health promotion, as conversations about prevention, nutrition. There are a lot of illnesses which you can have now, self-examination yourself. There's self-HIV testing yourself. There's lots of things that you can do now yourself as an individual, and as a community. There's also health monitoring and community engagement activities that can improve the health of people living within a community. And I think that's some of the areas that I will quite focus on when it comes to PHC. Yeah, I'm looking forward to this discussion. Forgive me if I twist it a little bit and include sexual and reproductive health and rights in most of the conversations that we'll be having. But it's also quite a key component for me, as majority of the young people in Africa, majority of people in Africa are young, and statistically, majority of the illnesses that most young people are quite concerned about are sexual, reproductive, and health rights related illnesses. And therefore, while providing the conversation about providing universal health coverage, it's also very important that the service that you're providing is a service that is consumable. And therefore, you should be able to provide a service that is that has quite a demand in itself to be consumed by majority of the people. And therefore, I'll definitely be excited to have this conversation. Thank you very much for the introduction.
Thanks very much, Bidian, for that. We're now going to introduce our next panelist, Obile Makaza. She obtained her Bachelor of Pharmacy Honours degree in 2020. Is currently a master's candidate in Public Health Pharmacy and Management at Sefako Makato Health Sciences University, SMU. She's a part-time lecturer at SMU. She's a Public Initiatives Officer at the South African Pharmaceutical Students Federation, SAPSF. She also served as IPSF Afro subcommittee member, particularly in the Regional Projects Office under the Public Health domain for 2020-2021. Responsibility included creating content for public health awareness on common diseases in Africa. She served as a representative for pharmacy students in a project called Interprofessional Education and Collaboration, IPECP, where the mandate was to educate healthcare students on how to practice as collaborative healthcare teams in the workplace. She's part of the Strengthening Interprofessional Health Education for HIV, STRIPE HIV, where final year health science students are trained to apply to an interprofessional approach towards HIV prevention and management. Welcome, Obile.
Good morning, good evening, good afternoon, everyone. Kapil, may I please ask that, is my video on? Oh, there, okay. Thank you so much. Thank you so much for this platform, much appreciated. I think personally, I've been waiting to, form part of such a vibrant young group of people, especially in the health care sector. And as Africa trying to move towards universal health coverage, it's very important that we have these conversations and to work together to see how we can make this possible for our people. I think for me, the first thing that I want to highlight is the fact that we as young people, as the youth of Africa, are an asset. Our ideas, our opinions, and our roles in the activism, especially for equal access to healthcare, are very much valid. And it is our duty, we should make it our mandate to advocate for this particular important aspect for our people. When we look at, I think our colleagues have defined what primary healthcare is, what it stands for. And I think for me, primary healthcare is a very crucial component in achieving universal health coverage, right? Now, my concern comes when the definition of primary healthcare is really largely focused on conventional medicines, and it's largely focused on us as healthcare professionals. I am a pharmacist by profession. What I find, or let me say, what I think is missing, really missing, and it's our again, it can be part and form part of our conversation, is the role of indigenous or traditional medicines in the definition of primary health care. And the reason I'm saying this is because approximately 75% of Africans would consult a traditional healer or would use indigenous medicines before consulting a healthcare professional. So when we come to defining primary health care, we talk about the first contact that a patient would make in seeking healthcare services. However, we exclude the one very important component that is traditional medicines or indigenous medicines, which is used or which are used largely by especially African people. So I think that if what we need to change as the youth of 2021, we need to relook the definition of primary health care and make it applicable to how Africans are living, how Africans are seeking healthcare, and what we believe, but also what really works for us. And we combine that, and as a interprofessional collaborative, I would say activist, I would say that the role of traditional medicines and traditional practitioners is really vacant, and we really need to look into that. Another thing I would like to highlight is the role of pharmacists, because I'm a pharmacist as a profession, as I have mentioned. Now, I think coming to especially South Africa, I'm not really well inclined in other African countries. I think with the pharmacy profession and pharmacists in general, we are really underutilized when it comes to playing our role in the primary healthcare sector. I often find a lot of areas, especially medicine areas, that could be really avoided if a pharmacist was present. Our healthcare system is largely dependent on the nursing profession. They play a very important role. However, I think there's a balance that needs to be, obtained, especially when it comes to the use of medicines, because medicines play an important role in not only the healing of whatever problem that we're working with when it comes to the health of a patient, but also in the affordability, because as Africa, we all know that when it comes to resources, be it financial and any other resource that is needed to achieve, especially equitable health, we as Africa really fall short. And in cases like using every healthcare professional that we have in order to maximize the resources that we have, I think we really need an improvement with that, and pharmacists could really play a big role. I'm looking forward to engaging with our participants and with all our colleagues. Thank you so much again for this opportunity, And I hope that we will advise each other accordingly and take whatever it is that will be discussed in this on this platform, and we'll take it and implement it. Thank you.
Thank you so much, Opile, for that really interesting call to action, especially the importance of traditional medicine and how the pharmacy profession is at the forefront, ideally, of also steering our primary healthcare space. As we wrap up this fireside session, I would like to give Otobo 1 to 2 minutes in case he had anything else he would like to add, because he did share with us a wonderful piece of poetry that also started off this particular session, and then we can head over to the plenary discussion.
Hello, 1 to 2 minutes. Okay, I'm Otobo. I'm very happy to be here. Just so far, so good. I've actually been learning a lot from the introductions so far. But working with the African Healthcare Student Summit, we usually approach things from a multidisciplinary perspective. So in everything we've been saying, I just kept looking at the different angles which we can approach things from. And just as we heard now, we can't keep considering PHC and ignoring the preference of the African people, which is traditional medicine. I think on the official structure of PHC, we have TBAs, traditional birth attendants, traditional bone fixers. So I think it's only like sensible that we also consider them as a means of other therapeutic options for Africans, and not usually when they go to some of the bad ones, they come to us with complications, like the case we had 2 weeks back. A lady was bitten by a snake, and she knew she was bitten by a snake, and she went to a traditional healer, and some things didn't go well. And 1 week after, the lady came here with so much complications. Luckily, she survived. So I think we also need to find a way to develop our traditional perspective as part of the multidisciplinary means of tackling Africans' health challenges. Thank you so much.
Thank you very much, Brother Otobo. So this concludes the opening remarks from our panelists, and now we're going to head over to the panel discussion. So I'm going to start off, and all panelists, as you know, are able to discuss and are welcome to engage in the discussion. So my first area of discussion or topics, I think, and this has been touched a lot in the opening statements, is what do you think of the role of youth in healthcare systems strengthening in Africa? And really talking about health inequity as well, youth inequity, and how youth can be more involved in healthcare systems strengthening in Africa. I'm just going to start off perhaps with Ornella, and then any panelist is welcome to chime in and evolve the discussion.
Okay, with respect to the whole of the role of youth in strengthening the health system, I want to say that it's high time we talk about considering COVID-19 from a person perspective. I think the youth have a lot of role to play, because when you want to consider the person perspective, you will see that we need to jump up. We shouldn't be youths. For example, I'm talking for the face of medical students. I will talk from the perspective of medical student. Medical student today, for clinical years, they go to rotation, they clerk patients. I think it's high time than ever before that youth should not be doctors of tomorrow that stay and wait for patients in the community. It's high time that we embrace healthcare that is focused on person-centered care. I believe that youth, we have the current society in which we have has proven that Patients educate from themselves from social media. They educate for themselves from the internet. So youth of today, future doctors of tomorrow, they should embrace patient-centered care in their approach to managing patients. And COVID-19 has expressed to us that people don't wait again and come to the hospital. The first contact of people is the neighbor. They talk to the neighbor. What have you done? You see, and those attitudes are easily contagious. People will not be wearing masks because they saw the neighbor not wearing masks. They are not informed. And vaccines has been showing us that even medical students among us are rejecting the vaccination based on their traditional belief, their spiritual belief, what their pastors are telling them. It shows that most of us are already corrupted. It is a real problem. And I think it is high time that our education system includes the patient-centered care and emphasize on the values in the future doctor. We need to raise doctors who embrace some values like honesty, respectful, and empathy, who embrace critical scientific judgment and evidence-based approach. Most of our doctors today are so corrupted by what they are seeing and what they hear from the social media. I start with our educational system. So I want to emphasize that youth today should be trained on patient-centered care. They have a role, but they should be empowered in order to play their role. So it is high time than never before to empower our youth in order for them to be equipped with the necessary skills in order to go and pave the way for the new order of public health. If not, they themselves will not have nothing to play. That is my perspective on this topic. Thank you.
Thank you so much. Now, like you said, youths have a role to play. But youths today, I'm referring to us now, we are kind of already like around. Oh, sorry, please, my microphone was. Thank you. Okay, like you said, youths, they actually have a role to play. And it's very important that we understand that what can we do now? We who are already doctors, who are already like rounding up everything, what can we do now? What role do we have to play now? I feel the roles we have to play now starts from the angle of politics and policy. Yeah. And if I'm talking about politics, I'm talking about we getting into the leadership positions, not just making subsections known as youth hubs and just staying comfortable. I mean, trying to push up there where decisions and policies can be made. And then when I'm talking about policy, I'm talking about us making policies to now implement reviews of our current medical training curriculum so that the upcoming generations can actually now have this training you're talking about. That's like what we can do now. So that's actually like my perspective, because I won't want to go back to medical school again and start all over again so that I can be trained in public health. I think the 8 years was sufficient enough. Yeah. Thank you so much. Okay, Brother Ahmed, you can go on.
Yeah, thank you so much for asking this important question. I think we need to highlight the three main components of the question: role of youth, health system strengthening, and inequality, the current situation, and the fourth component in Africa. So I think the first thing we need to highlight for youth, the attitude or behavior. As my colleague mentioned, that this is very important to think that we are the leaders of the future. As well, I want to add, we need to spread the concept and the attitude of we are the present, not only the future. We need to be empowered today to take the lead now. The second point is the health system. So we need to empower the youth and healthcare professionals. What is the healthcare system? What are the main components or key components of healthcare systems? For example, number one, leadership and governance. Number two, health information systems. Number three, health financing. Number four, health workforce. Number five, resources. all the different type of resources, and the last one, service delivery. This is the main key components, or 6 key components of any healthcare system. After I identify the healthcare system, the ideal one, now I can check my healthcare system in my country, the healthcare system in my country, and then I can compare it with the other 54 African countries. This is the 4th component of the question. In Africa, we have in Africa this Africa Agenda 2063. It's a very passionate agenda for 50 years, started in 2013. So we need to combine and comply our plans, our passions toward the healthcare systems in this Africa agenda. I think in this way we can empower the youth and enhance the role of youth in qualitable health systems strengthening in Africa. Thank you.
I completely agree, Ahmed. I couldn't emphasize it any better. I think, however, it goes back to, you know, the huge role that we as the young people have to play, because when you look at the definition that Ahmed has given us of healthcare systems, I think it doesn't really emphasize enough on the importance of ethics, because we have leadership and governance, yes, and those are very much applied in all our continents. We've got governments everywhere. However, the importance of ethics in the governing and in the leadership is not emphasized. And we often assume that when you're a leader, you'll be ethical, or when you are in governance, you lead your people ethically and with integrity. And I think that's another problem that we are really facing in our continent, because we are often talking about corruption, this, corruption, that. And if we look at these building blocks that Ahmed has given us, they fall short most of the time, because we do not seek enough accountability from our leaders. And then we end up, because each building block depends on the one building block depends on the other. So if you don't have the finances, or if you don't have the workforce, or if you don't have the medicine supplies, then it's difficult to deliver the service. And if you look at the reasons why the finances are not there, or the workforce is not enough, it goes back to the governance and the leadership. And if we dissect that further, the lack of accountability is a huge portion of it. The ethical practices and the ethical leading is a huge part of it. So I think going back to I think it was Daniel, when he mentioned the importance of us in getting involved in policies. That is very important, because the reason why things happen the way they happen, especially in the healthcare system, is because they are policies that guide and tell us how to do certain things. However, those policies were drawn up years ago, and today we are here and we are living the reality of the inequitable access to healthcare services, and many other things that come into, or that let me say that lead a barrier to us reaching our sustainable developmental goals. So it is important for us to not stick to what we learn, because when we're students, I think we take this culture of just learning whatever you learn and then you move on, you go practice. It's important for us to be open-minded when we get to the workplace, and to see that are the things that we are working with now still relevant for us. And if not, we then take the steps into changing or into converging what we think is right. When I started, I did say that our ideas and our opinions as young people are very, very valid, and they're very, very important. And that's the only way that we can change, or we can make the change that we see necessary, is for us to get involved and to not feel short of what we are thinking, or the ideas that we have, or the opinions that we have, no matter how different they can be for what is currently happening where we are.
Well, it's quite tough to follow Wakaza, He seems to say everything afterwards. Yeah, and I agree with her that it's important for young people to not just align, but also important for young people to disrupt The reason we find ourselves in this current mess in the healthcare system is because we are falling in place in an already established system, a system that has poor health-seeking behavior and has accepted it in itself. Yeah, a system that has accepted infection, like misuse of resources within healthcare services, a system that has accepted and has promoted patriarchy in itself, yeah, and toxic cultural behaviors that have led us into this place. As young people, we need to prioritize it. And it's nice that young people can be doctors now, but there are also doctors that have been taught within this particular system. And maybe as a student, you don't get to decide your curriculum, you don't get to decide some of those things, but then now you are in a position of decision-making as a healthcare professional, and maybe it's time for you to dictate a particular direction for what is important for young people, right from being a healthcare provider. You can be a healthcare provider and you get to know issues like youth-friendly services within your hospitals. They are not a priority to the administrator, and they're not a priority to maybe the duty bearers within the region, but you as a healthcare provider gets an opportunity to suggest that it's prioritized and make sure that it's located in a place that young people can access it as easily as possible. We, as young people growing up, we have been under the care and the environment of communities that have a huge influence. And sometimes, actually most times, we tend to underestimate how much influence these things are. Most times you think you've made a decision, but you haven't really made it. A lot of factors around you have led you into that decision. Your upbringing, your colleagues who are also just being bred through this same community. And if you want to meaningfully influence the state of public healthcare in our communities, we must be able to interrogate and also criticize things that we think are the status quo. We might be able to question it properly. You need to ask yourself, why is it that in your community, the dispensary only has nurses and probably not doctor or no pharmacist within that dispensary, and they're the primary focal point for people within that community or village is a referral hospital. Yeah, as a healthcare provider, you also need to fight at the social norms and the niceties that come with being a healthcare provider. Why are you more willing to work in a city center? Why are you more willing to work in a situation where you want to be employed at in a referral hospital, which is fine because they also pay well in that one. But then if the problem is about payment, then you need to standardize some of these payments so that it is also as appealing to work in the marginalized communities, to work in the hard to reach areas, for ability to have the best possible healthcare providers in a dispensary. That is the primary focus point. And that way, maybe that way, as young people, we can start disrupting this. Because trust me, the older doctors who have been there for 50 years are not looking forward to work in the dispensaries or have conversations with the community volunteers and stuff like that. They're not doing that. If there's somebody who is energetic and excited enough to do it, then it has young people and healthcare providers that may be. The second part is also to notice that the young people that are not necessarily educationally uplifted are not the minority in these situations. The issues of education is quite a huge one still in African countries, and there's an increased rate of young girls and young men that have dropped out of schools and are not having access to education. But sufficing to say, these people are quite influential within communities, and they are not people that should be assumed. So despite our education, despite the benefits that we have accrued by access to universities and education and now being doctors and stuff, it's important that we also identify that the leaders within the communities are not as educated as we are, and the young people that are shaping the opinion of the community are not in the position that we are. Therefore, we need to have honest conversations with them within the community to see how beneficial this is to them. Imagine in Kenya during elections, the young people who are riding motorbikes as border borders and some of them who are taxi drivers, are educated enough to carry people almost for free as an emergency to ensure that they can vote, because they know how important it is. How important is it for people to access healthcare? They need to know how important it is. It needs to be the most important thing. How important when they have demonstrations that roads are not built, going to shopping center. These are the same people that can champion for infrastructure that make it possible to access health dispensaries and hospitals that are not yet renovated. The elite are quite the minority, yes, but they can lead the conversations. But importantly, they shouldn't lead the conversation in isolation. It's important to include every aspect of the community, because those people are already questioning the status quo. And it will be quite a disadvantage to us if we don't question the benefits that we have and benefit the systems that we are a part of, so that we are able to come up with a better solution for everyone within the community. I think that's it for me for now.
Yes, just to add to what everyone has mentioned, I guess a very important thing that like the youth must do, we need to work on like actively advocating for the primary healthcare. And like it's very important because like very many youth, I would see that many youth just ask for their engagement without actually meaningfully engaging. And this is an issue because like this is this sometimes what makes decision makers skeptical about including youth, because there are some like sector of the youth who just ask for engaging without actually doing something in their engagement. And like in one of the sessions I attended before, there was this like statement that was said regarding like, if we can't engage meaningfully, then we shouldn't engage. And I believe this is very important in terms of like what youth should do, because we need to lead by example. We need to show that actually when we engage as youth, we'll be able to provide important inputs, we'll be able to contribute meaningfully to the process. So this is very important. So in addition to advocating for our meaningful engagement and for our inclusion in the decision-making process, we need to work on the active advocacy for the primary healthcare by engaging in the policy formulation itself. And of course, we need also to like from like a medical student perspective, we need to include this in our curricula. And it's not just the medical curricula, but all like the relevant curricula. Because as I mentioned earlier, like it's very important that we take a multidisciplinary approach. So it's not just healthcare, not just doctors who should be involved, not just pharmacists, not just veterinarians, not just certain sectors, but all the healthcare professionals should be involved. And everyone should be trained and well educated about the primary healthcare in order to be able to like work on it and further improve on it. And like in addition to this, in addition to empowering each other, we need to empower the community, because the community is the most in need of this primary healthcare sector. And like the indirect lobbying or using the grassroots in order to advocate for the primary healthcare would be the strongest tool. Because if the people know the rights, if the people know what they want and they advocate for it, then they would be the main like group who will be able to get their needs addressed. So it's very much important not just to empower each other as healthcare professionals, but also empower the community and empower the society to identify their needs, to identify why they need primary healthcare and how they should ask for it. Thank
you. Just a little bit of butter and jam on what has already been said. I'm looking at Mohammed's perspective of improving the curriculum, yeah? And now, if we're looking at the perspective of improving the curriculum, I've come up with an idea of electives. Now, those who are doing humanitarian sciences, in humanitarian sciences, they usually have courses known as elective courses. So we keep asking ourselves, the medical curriculum is already standardly built to take us from a point of what we know to things we don't know, that from preclinicals to clinicals. So at what point in time do we include all these numerous courses we keep talking about? I think we need to create something known as elective courses in medical school. And in these elective courses, we could have an elective course for preclinicals and an elective course for the clinical year. Or we could have an elective course for every year. The elective course necessarily does not need to be long. It could be a 2 weeks course. For example, in CPHIA in Nigeria, you focus on obstetrics and gynecology and you focus on pediatrics. Now, you could have an elective course such as, let me say, social pediatrics, for example, or an elective course in reproductive health. Now, many people don't know, but there's actually a difference between obstetrics and gynecology and reproductive health. And we could have like an elective course for reproductive health. So a student will choose for your elective weeks, next 2 weeks, would you be doing the elective of reproductive or the elective of pediatrics? Now, another idea is if we look at that's how youth can actually contribute now. If you look at the WHO delays, the WHO delays actually have three. That's delay deciding to go to a hospital, the distance between your home and the hospital, and the distance, and the decision problem when you get to the hospital, the health workers deciding to act or doing proper care. So if we want to make these delays into 3Ds, the delays are decision, distance, decision. So I feel youths can help in the first and the last decision. Now, when we come to the third D, the second D, which is the distance, that has to do with government, that has to do with leadership, that has to do with the community trying to create roads and cleared paths. But we can actually help in the first decision and the last decision, that's deciding to go to the hospital and what the health workers will do. In deciding to go to the hospital, we can give them reasons enough to prefer hospital care than just staying at home or unverified traditional care. Now, there are some traditional cares I've heard have good results, but there are some unverified ones, like those who use metals and bicycle spokes to do dilection and curettage, D&C, those who use razor blades to cut people who have been stung by snakes, who are already at risk of DIC and coagulopathies and bleeding. Now, those are unverified traditional care. So we can do proper advocacies to the communities so that they can know, hey, the medical doctors or the medical students said if we have these symptoms, we could go to the hospital instead of just staying at home. And then as health workers, young, vibrant health workers, we shouldn't be laid back, and we should try and improve the speed at which responses are given to patients that come in, and not just judge them as being Munchausen's patients or patients that have fastidious complaints. Thank you.
Fantastic. I think this first question has really started off with a bang and has really thought-provoked us into this particular discussion that we're having this morning. And without further ado, I think what I'm getting generally is all professions have a key role to play with regards to strengthening primary healthcare systems in our region. And as youth, we should end tokenism and also probably have a key role in our curriculum development, and probably even think of having elective courses which can further empower us on what we learn in our school work and not just what we have on the books and on the textbooks. And now this takes me into, now that we're thinking about ways of improving what is taught in school and way of empowering ourselves as youth advocates, it takes me now into new frontiers of healthcare. Essentially, how primary healthcare and digital health can intertwine, and its importance for us as the youth in Africa and as young, either healthcare workers or healthcare workers to be. And I think I'll start off this question with Mohammed, probably just give us some insights.
Yes, thank you so much. So regarding this, I believe this would be very much important. Like the digital health, it has its pros and cons, I believe, from my point of view, especially in terms of Africa. It's very much important to explore the digital health aspect, especially in terms of the health information systems. As we mentioned earlier, like the primary healthcare is part of the health system, is involved in all the building blocks. And it's very much important to see how the health information systems, which is one of these 6 building blocks, can be further developed using the digital health. In many areas, even in my country, we still have these like physical paper registries, instead of having, for example, systems just to get data on the patients and get data on the hospitals and get data on different health-related aspects. So the thing is, digital health can be very much important in the health information system, and even in different areas in terms of like treating the patients and providing them with preventative measures. However, on the other side, are the people in our communities ready to use digital health, ready to cope with digital health? This is the issue. And this is why I mentioned in the previous question that it's very much important to empower the community and empower the society in general and empower all the target groups in terms of the aspects that we want further development on. So if we are focusing on digital health, it's very much important that we get to make sure that our community are able to deal with digital health, that the patients are able to use, for example, electronic devices or use applications to take care of their health or to get in contact with their doctors, for example. These are certain aspects that need literacy, need health literacy, a digital health literacy in terms of the community. If we are able to tackle this, if we are able to identify the baseline and the needs of the community in terms of the digital health and how we can use it to further develop the health systems, the primary health care and the health information systems, then we should move forward with this. Thank
you. Digital health as a concept is actually something I've seen as a bit of a bittersweet challenge. Now, some weeks back, there was this session where there was a conversation also on AfroPHC concerning digital health, and a lot of people highlighted their challenges. Now, if you look at when it actually came to Africa, our challenges were a bit similar in the sense that we were complaining about technical know-how, we're complaining about facilities, we're complaining about knowledge, we're complaining about those who are going to repair their equipment. But most importantly, there was something someone said. He said, you cannot be bringing computers and trying to talk about digital health when the normal health facility is still lacking light, it's still lacking water, it's still lacking staff, it's still lacking financial backups. So we already have like more problems than we can handle. Now, I'm not talking against digital health. I'm just saying that we already have so much problems. And when digital health comes, we are now going to have health problems, social health problems. We are going to have medical health problems, and we're now going to have digital related health problems. And then we just keep piling up our problems and we have very little solutions coming around. I wrote a paper on use of telemedicine in primary health care. And from that paper, you would see that telemedicine, let me say digital health, had a lot of promise if used in primary health care, especially when you talk about things like distance antenatal clinics, and you have HIV consultations and everything. But by the time you now go to the challenges were so plenty. And although we just tried to profile one or two ways we could work on the challenges, you find out that bringing digital health into primary health care at the state Africa is right now, it's not too feasible at the moment. It's going to pose more challenges than good. We're not talking of tertiary or secondary health care, we're talking of primary health care right now. Thank you.
Yeah. It's very nice then I get to debate with Otobo now, so it's good. But I have a contrary opinion to my good friend and Akari, Daniel Otobo. Yeah, I think also the other thing about healthcare that we also need to remember that healthcare is not just domiciled within the doctor, the nurse, and the pharmacist, but also talking about the public healthcare providers, that there is people who study public health as healthcare providers, and also we have the nutritionists as part of it. In Kenya, I am not so sure where the public health workers are employed, at least in government. Most of them I've seen that are employed particularly in NGOs setup, and I'm sure it's not very different from other communities, that you have some of these similar situations where, I don't know if any of you know if public healthcare students are employed by government and how many are employed by government every year. I'm sure it's quite low. And when COVID happened, COVID is a public health crisis. And the people in the forefront of preventing this COVID-19 are the doctors, the nurses, the pharmacists, which is honestly quite sad, because we learned very little about handling public health crisis. The prevention part of it is not a very huge part of a medical curriculum, prevention. We wait for patients to be sick and then we treat them. After they're treated, a lot of times, particularly in my country, rarely do you find a doctor having time to tell the patient why you got sick. It's just treating them and then they're ready to go home, and then you don't tell them anything to make sure that they don't come back. Is that a safe healthcare service is created with a response mind. It's waiting for patients to get sick, then they come to the hospital again. The interesting bit about digital healthcare is that it doesn't necessarily need to disrupt the healthcare service that the doctors, the nurses, the pharmacists are providing, But then this, if endorsed, because yes, it's true, a lot of people are skeptical about using it, but they're skeptical because the people they trust haven't endorsed it. If the government says people get vaccinated, some people will be skeptical, but the government has said, and the leaders that they believe in, their community leaders, people they call, that are quite influential in the communities, if they do it publicly, then people align to it. Same to digital healthcare. If the government decides to create an infrastructure that would allow public health students, or now public health professionals, to use it, not necessarily for treatment, because well, the issue is on treatment, but digital health goes up to prevention. But then it can also be an opportunity for Q&A, so that people can get to us through this platform, where can I get vaccinated? I'm traveling, where can I get vaccinated within this region? And then they're like, okay, you can get vaccinated in this place. I'm having these symptoms, my neighbor has this, my neighbor has this. How can is there a problem? Then healthcare providers can say, it's actually okay. There's a flu right now, but it's also because of the weather and stuff like that. So check it about these days and then give us feedback. And then they don't need to go and cram the hospital for that, when they just need to wait and then go to a hospital afterwards. Issues about preventions of like malaria. Somebody was talking about malaria. If there's like an outbreak of malaria, there's a lot of things that needs to be done within the community, clearing the bushes, the water points. Some of those things we do not necessarily need for them to go to hospitals, because anyway, they will not be helped there. But then using some of these digital platforms could be an opportunity. The challenge now is that everyone is Googling. And in Google, you get anything. You know, if you Google how to die from eating rice, you definitely get a results. And if you Google how to, you'll get a results for anything in Google. Everything is just put online. But an opportunity for digital healthcare is not just for a one-on-one, but also having a platform that has certified information that is endorsed by the government itself, or another international organization in itself, is a key part of digital healthcare. Not just in telemedicine. Telemedicine is the advanced stage, but just on a primary level, it's just a platform to get information, healthcare information, which will be very beneficial. And if there are people who can get this as a tapped opportunity, are primary health professionals, who then can get this information out there and can help guide members of our communities. Yes. Over to the next person.
Yeah, thank you, Bidan. This is Ahmed. I just want to add a little bit thing. We need to realize as a youth, we need to realize that digital health, it's not an easy issue. And it's not a matter of health. It's not a matter of multidisciplinary approach. It's a matter of intersectoral approach. I mean, many sectors in the country need to cooperate closely with each other to provide this digital health. So if we can see, we need a cooperation between the Ministry of Health and Ministry of Communication, Department of Transportations, Social Ministry of Social Issues, many sectors in the community. We need to work together. In terms of youth role, we need to learn how can we communicate with policymakers? How can we convince the decision makers in terms of health economics? How can we convince the policymaker to invest in digital health? How can we lead this intersectoral approach as a health sectors to do that? And we need to think about the digital health from many perspectives. The first perspective, how can we create a digital ecosystem in the country? And another thing, this transformation must be strategic and sustained process, and it will take a long time. We need to consider this perspective. Another perspective, we can take some quick actions. For example, this telecare or telehealth. We saw that in COVID-19 during the pandemic, we saw that some countries created this like national mental health helpline So you can call by the telephone and you can access the mental health. You can speak with the mental health nurses to make triage through the telephone. Then you can refer to psychologist or psychiatrist according to your case and so on. So we can take some actions in a short term and in a long term. Eventually, it's very important to think out of the box, to take some youth initiatives, some simple actions in terms of digital. We are very lucky generation. I think most of us millennium generation. And so we are very lucky and we have a good access to the internet, how to create applications, websites, social media connections. We can use the social media as a part of digital health in a local manner. Thank you so much.
So when it comes to e-health or digital health and combining that with primary health care, I think there are pros and there are cons. And I mean, during the pandemic and, the nature of the COVID-19 virus, e-health has played a very important role when it comes to especially communicating, or rather, let me say communication between healthcare professionals as well as patients. So, for example, I know in some of our hospitals where the resources are available, there has been that system where the doctor and the patient are able to communicate without coming into direct contact, especially for COVID-19 patients. So e-health has played a very, very crucial role, and it has advanced, our functioning in our healthcare systems, and especially also when it comes to the access of chronic medicines. So we have a system where patients are able to actually get their chronic medicines or their repeat prescriptions without actually going to the clinic. So that has also made it easier for patients to get access to their medicines. And what that has done is that it has sort of bridged that gap between, let me say, it has sort of reduced the inequality access to especially medicines. I think the one challenge though is that we are talking about Africa, and again, the resources that we have are not always sufficient, especially when it comes to digital access or when it comes to the internet. Because I mean, there are some parts of our respective countries that don't have internet access at all. So it then again brings us to the cons thereof, to say, are we really going to limit this inequitable access, or are we going to spread it even further? Because if we implement the e-health fully, then it means there are certain parts of our countries that are not going to be catered for. So I think with e-health, it is very, very important for us to first look at the access thereof. It plays its role and it makes life so much easier. However, it just might open up the gap that we are trying to actually close when it comes to, like I was saying, equitable access to healthcare. And then we might not even be able to reach our 2030 SDG goals, because then we'll be working backwards. So I think it's it's worthy to advocate for it. However, in the same breath, we then need to look at how we can solve the problems that might arise with implementing it fully. Thank you.
Okay, thank you, Makaza, for your intervention, and thank you to all those who have intervened with regard to this topic. Just for the sake of our audience, I would like to reemphasize on what digital health is before giving my point on this. Digital health is actually an umbrella term. It's is the ability of using technology to meet healthcare needs. And when we talk of digital health, the healthcare needs cut across doctors' consultation, it cuts across hospital management, it cuts across health information system, it cuts across wearable devices, telemedicine, and personalized medicine. I would like to emphasize on the role of youth in personalized medicine. And again, coming to patient-centered care, it's true that we have mentioned, many of us have mentioned already, I think Otobo, the drawback of telemedicine, and Ahmed emphasized on social media. And I want to say that it's important that we see digital health for the youth as room to boost the health system. They can do that in promoting health. If we want to take health, digital health just from the drawback, it might not be helpful, but it's good that we see it as an advantage. It comes to enhance our ability to provide and to meet health needs of our population. So talking about digital health at this era, we cannot go behind. We must use the technology. So I just wanted to mention the few aspects on where we can, how digital health can help us in enhancing health of our community. We can use it for promotion of health, as Ahmed mentioned. If you're a youth today and you cannot use maybe a Canva app, or you cannot use a Twitter to make a social tag on vaccine, you cannot use your Facebook or your WhatsApp statue or your Instagram statue to share about important health matter during a worldwide day, or maybe a worldwide day. These are little action that can make a difference, I believe. They are very important health days. You see, TB Day, HIV Day, Diabetes Day. These are the little things. Traumatic Day. If you're somebody that is passionate about reproductive health, don't miss a day talking about menstrual hygiene. If you're somebody that is passionate about surgery, don't miss a day when we are advocating for UHC and leaving surgery behind. I think that youth have a role in raising their voice in promoting healthcare through information system, and we can make use of it to raise our voice, that we matter about the health of our people. I think at this level, youth can also play a role in personalized medicine. When you're consulting your patient, try to identify if the patient before you is educated. If he's educated, you're supposed to be flexible. That is what we call personalized medicine. You can be the next generation of doctor that meets patient needs depending on their personal preference. It means that if you have a patient that maybe is not currently coming for consultation, you notice that he's a diabetic patient, he misses consultation all the time. You are the doctor of the 21st century. You should give him the probability of consulting digitally. And if he's well educated, you should offer room for consultation for follow-up. Maybe by today we do consultation by WhatsApp video, and these are the small ways we can do to use digital health to enhance the healthcare of our community. If we continue to allow them to go and consult maybe Google and all those things, and not being aware of the health issues that affect them, is going to be the fault to us, because we are not educating well. So I want to say that youth have a powerful role in using digital health for health literacy and in personalizing medicine. Thank you.
Thanks very much, Onela, and thanks to our panelists for really, I think, this fantastic discussion that keeps on building up and progressing. We just started talking about how digital health and primary healthcare can intertwine, going over the many benefits and advantages, but also hearing the debate there and some of the cons and how we need to carefully implement this, as well as the latest contribution from Onela looking at personalized medicine. So we're now moving on to the next topic and the final topic of the discussion. We know that we're now in looking at the COVID-19 pandemic that has just resurged and intensified, with many countries going on to third, fourth, fifth waves. And one of the gravest challenges that we have, particularly in Africa, is with vaccination. If we look at WHO, we look at CDC, Africa CDC, UN, everyone is talking about how one of the greatest public health interventions is to vaccinate. But there are a lot of threats and challenges to this, and particularly in Africa, we look at vaccine equity, which is a major challenge. Whilst many wealthier nations are pushing onto booster vaccines that have vaccinated over 50, 60, 70% of their population, recently analytics showed that in Africa CDC from yesterday's plenary session showed that there's only 7% of the population that is vaccinated in Africa, which is tragic. And if we go according to the current trend, we'd only notice that Africa would be fully vaccinated somewhere in 2023 as a best case scenario. It really is a tragedy. So this introduces the next point here that I'd like us, our panelists, to discuss is how can we adjust advocacy strategies and tactics to ensure that equity gaps are addressed. And I'm just going to put this question out there. Perhaps we could start off with Bidian on this.
Well, this is when the one time I was hoping I'm not going fast. And I guess that's what hope gets you, yeah? Well, they say, and that's where I'll start. Hope is not a strategy, you know? Well, equity is an important component in healthcare service provision, and African countries can't fold their hands and hope as a strategy. And it's important that we need to work together as African states. So there's a conversations now I saw recently that the president of South Africa, Cyril Ramaphosa, was giving quite a nice, moving speech about the importance, what Africa really wants and how they can fight COVID-19, that we want to make those vaccines for ourselves. Because if they just loosen the patent, then we're able to make millions and millions of vaccines. Yeah. But I'm going to talk more about the other aspect of this, which is trust and distrust. Trust and distrust in governance is the ability of people to trust their government and also distrust their government at the same. For most of the developed countries, people trust their government quite a lot. When the government says do this, then they don't think, they believe that it is for their own good. And this is because of governance, and their key issues are key in political processes. Things that are important to people are key in political processes. Like now people are talking about building back the economy, building health systems and making them stronger, because some of those are key issues. But for us as young people in Africa, and also health professionals, we need to make sure that key issues, things that are important to us, are also political issues within the country. Because health is a political issue in itself. Health requires access to resources that are in competing interest in a political dynamics, because the same money that goes to education, and trust me, there are lots of NGOs fighting for education. It's the same money that also needs to go to health, and also the same money that needs to go to the environment, same that needs to go to civil service and employment. So it's a competing issue. And to address equity, key issue is access to resources. So for now, let's say in healthcare, how are we ensuring that for countries like Kenya has a general election coming next year, how are we ensuring that healthcare is on the table as a political issues, so that everyone that is vying for the president has healthcare as a key agenda, and what exactly is their policy within that healthcare to address issues of access to resources. Yeah. And on a continental level, working together as African states, and now, of course, with the African CDC, we are able to pool resources that can give us a joint bargaining power for this one, that could ensure that at least, you know, yes, they're talking about 10%, 7% that's vaccinated in Africa, but still, there are lots of countries in Africa that are at 1%, while others are at maybe 40, 50%, around 30, 40%, because of a huge bargaining power and lots of vaccines that are taken towards those countries. But if we argue about this as a unit, we're able to even get more. The conversations about vaccination in European countries is done through the EU. And you see how they jointly agree to ban AstraZeneca, jointly agree to start using this other one. And some of those conversations, they help us to work as a unit. And as much as you don't get to an ideal situation where everyone has access to a particular service, But working together has proven to make sure that you get at least more resources that then more people in the community can get to share it. So issues about vaccine, Kenya has just received additional like millions of vaccines recently that are supposed to be vaccinated, but then the turnover is starting to reduce, while we have countries next to us that are still they have a high turnover. They really have more people who want vaccines, but it's not reaching them. Then it's possible to see these resources as not our resources. And of course, the rich countries should not see the vaccines as their resources, but it's like a global resource. That if you don't have the demand for it at a particular time, then just take it to the next country so that it's used at that time. And you can focus on publicizing to your country's citizen on the importance of vaccination. When they come around, then get the vaccines and vaccinate them. But let those who are willing to be vaccinated as soon as possible. And the rest be well informed and convinced that this is important. Because as they say, nobody's safe until everyone is safe. Thank you.
Thank you so much. It's a pleasure to be debating with Bidian. Now, taking the attack stand, I think I need to clear a misconception. I don't think the primary problem of vaccination in Africa is availability. Now, that's a problem, but someone said initially, you find, I think it was Pokam, that you find people saying because their pastors say they shouldn't take this, they don't take it and things like that. So we need to clear the air. The primary problem is not availability, accessibility, but it's acceptance. We have the problem of the end time message here in Africa. So we have like the whole 666 problem going on. So I'm currently in a teaching hospital, and last week I'm upstairs and the secretaries and the professor's office are all discussing the vaccine, and they say, oh, Daniel must have taken the vaccine. And everybody was like, Daniel, you've taken it? And I'm like, I took something. And they're like, you've taken it. And they were all looking for the 666. And I genuinely was actually embarrassed to actually say I've taken it, because in that whole room of about 15 secretaries, I think they were having a meeting, I was the only one that had taken the vaccine. And this is a hospital, for God's sake. Now, if we go further again to the proposition on politicians, I think we're in Africa and we need to differentiate between politicians and politicians. So most of Africans are politicians. They are there to thief. They are there to steal. And so even when you go and meet them and you tell them, civil play, can you add health in your manifesto? They'll be like, beautiful. Like, and they'll all be like, this is a beautiful idea. Just write everything you want me to say down and send it to me. And then you even now see a politician quoting medical terms. The astrocytoma stage 4 glioblastoma is a problem in Africa, but let him get into office. And then you now find out that those were just what? Election promises. So I think we've been playing this same tune for a long time. That's the tune of political promises. And we need to start looking through other channels. But a very, very, very wonderful and bulletproof point you brought up was the point of unity. And we find the European Union making joint decisions and saving themselves and things like that. I think that's something Africa needs to take up. But from what angle are we going to start this unity? We can start this unity from the perspective of having, let me say, AfroPHC Youth Hub, for example, having multiple groups around different African nations, and then having targets such as the AfroPHC in West Africa aims to at least enlighten 1,000 people in 1 month in a particular region. So if we have 1,000 people enlightened in every country and 54 African countries in 1 month, then we know in 1 month, we've had about 54,000 people enlightened. With a larger number, we would be able to make that about 540,000 people. We had a target of 100,000 people per month. And if we can keep having this joint enlightenment, and with every community enlightened, as you're ending your enlightenment, they're like, the vaccination team is moving in, and we have this exponential structured increase in number of people that have been enlightened in Africa. We would have to use this channel because you see European nations, their languages are basically Francais, Anglais, just basically English and French, and they just understand themselves. But when you come to Africa, when you come to Nigeria, you're dealing with about 700 and something languages already. So getting joint messages, we need the indigenous people. So that brings us to the concept in public health known as community entry. So we need to like employ community entry. We need to do structured intervention and advocacy followed by structured vaccination. And this way we'll be able to now exponentially increase the number of people vaccinated in Africa. And hopefully by next year, we'd have been able to convince people that even if Lucifer was going to come, he was not going to come through SARS-CoV-2 and the Omicron variant. I think that's what I wanted to add. So using the whole politicians' promise is going to end up as an election promise, and the end time message is actually going to be a debate that we need to debate with the pastors and with the community. When we have, I've forgotten the study, but by the time we have pastors preaching medical messages and not just politicians quoting medical terms for votes, we'll be able to like deal with a lot of the fake news that is already circulating. Thank you so much.
Well, I've been advised a lot to jump, and I've been told to jump for my honor. Sorry guys, sorry to interrupt. But yeah, I agree with everything what Obo has said, and I think it's very critical to come up with parallel ways to reach out to as many people as possible so that the information also gets to as many people as possible. But still, I also wish to insist that it's important to target our politicians because health is a governance issue. Everyone pays taxes and the duty bearers are the government. If you do not trust your government, then replace them with leaders that you trust. Because at long last, the government has to provide the service. And it's important to strengthen the already existing structures that are there. The government has a Ministry of Health, has a Ministry of Public Health, has a Ministry of Education. And if we come up with something that is important to us, because that thing becomes a political thing, they need our vote. If the majority, if you can't convince the politician, convince the voters. If the voters insist something is their priority, then the politicians will want to save their jobs by making sure they are tackling that. We need to figure a way to make it a priority for us. And there's nothing that makes us any different from other countries in the West. All the challenges that we have accepted that we can select leaders who do not implement and then return them into office. But if we are able to change that as young people, make sure that our priority are what gets leaders into those positions, then I think we have something. Over to the next speaker. I can see.
Yeah, okay, sorry. While the next speaker comes up, I feel it's important to highlight something. But I'm not saying we should not challenge our politicians or get involved in politics. I'm more from the perspective of we should not allow them sway us to the angle of using our desires as political promises. In Africa is very, very keen for recycling old leaders. In my paper on youth engagements in policy implementation in Africa, you would notice that Africa has the oldest, the largest gap between the age of the president and the mean age of the country. Now, for example, the space between the age of Muhammadu Buhari, the president of Nigeria, and the mean age of Nigeria, that space is more than the life expectancy of an average Nigerian. I don't know if you get it. Now, the space between our president and the mean age of the youths is not up to the age that average Nigerians live up to. So, and then this was the man who came promising to take care of health needs, insecurity, education, paying the unemployed. And what happens? Killings have not been worse than before. And doctors have never gone on strike as much as health workers have gone on strike now. And to a point, the president comes down and tells us, oh my God, I've tried my best for Nigeria. Only God can help this country right now. How would the president say that? Now, this was someone who appealed to the voters. So I think the point you made that I'm going to be like tagging along is if you can't convince the politicians, convince the voters. And then the voters should not now vote based on promises. The voters should vote based on track record. Hey, Mr. Politician, before you wanted to come into this office, what have you done or supported in terms of health that will let us know that health is important to you? And not just you making promises based on the fact that we see you driving flashy cars, we feel you have the money, you are going to live up to your promises. I mean, thank you so much. Next speaker, please.
Been quite fiery one.
Yeah, no, this one is it's a very deep. Anyway, for me, I think I agree with Daniel to some extent. You know, the issue of vaccine hesitancy, it's a very, very, very huge challenge, because we can have access to vaccines and have, you know, enough vaccines. However, the acceptance and the human behavior around, you know, the vaccines and the conspiracy theories that go along with it can really, really pose a challenge. And the point of getting vaccines and then they are not utilized and they end up then going to waste could really, really then set us back, especially as a continent with you know, shortfalls of resources. However, we cannot deny the fact that I remember I was watching a webinar where the World Health Organization Director General, Dr. Tedros, was a panelist, and he defined the vaccine inequality as vaccine nationalism. A very political, you know, term. However, that's exactly what happens in some African countries. The access and the availability of vaccines are almost non-available. However, like we have mentioned, you have other countries who have an excess of vaccines and they've vaccinated most of their population, and they just refuse to distribute those vaccines to countries that actually need them. Now, how do we then approach this issue? For me, the first thing is to look at the patenting policies, because COVID-19 is a public health emergency. So I don't see why these vaccines are not, you know, given the green light to be produced in other countries, and they are just, you know, segregated to specific countries, especially European countries, who, by the way, have, again, I emphasize, vaccinated most of their population. Now, the important thing for us, especially as Africa, is to start producing our own vaccines. I think we have enough knowledge, we have enough workforce. Here we are as young healthcare professionals on this platform and our colleagues in the entire African continent. It is time that we also put our heads together. We also do the necessary research, and we then go ahead in producing our own vaccines. Because what that will assist us with is it will reduce affordability problems, it will reduce accessibility problems, and we can then also hopefully get to a point where we are able to vaccinate most of our population. Again, with patenting comes pricing, right? So those who have the patent, those who have the active ingredients and everything that goes into making the vaccine, they control how much that vaccine should cost. Recently in South Africa, our competitions committee has challenged the pricing of COVID-19 tests. And actually that worked, because what has happened is that the tests have, the pricing of the tests have reduced significantly from, I think, 850 Rand to 500 Rand. And before that, they used to cost 1,000 Rand. So yes, we have the government that is leading us in our respective countries. However, we do have those committees that advocate for the people on the ground. And I think we as young people, again, need to realize that we don't need to be in position of government in order to change certain policies and strategies in the way things are done. We need to take the example of the competitions committee that I'm talking about, or competitions commission rather, and take what they have done, do the thorough research, and advocate for what we think is not working accordingly or is not efficient in serving the healthcare needs of our African people. The pricing of vaccines needs to be really challenged. I think if they can be reduced, and then we look at the affordability of our respective African countries, then we should be in a good position to bridge that vaccine accessibility or equity gap. And lastly, I would like to highlight the notion of the president of Rwanda, President Paul Kagame. He is on a mission to produce or to have or to establish the first mRNA vaccine plant in Africa. This is a huge challenge because firstly, it needs all African countries to unite. We spoke about the unity. It needs African countries to unite and to advocate for this notion to go forward. Because if we can have an mRNA vaccine plant in Africa, then we'll be in a position to control a lot of things. Again, affordability, accessibility, and those are the important components. And we already spoke about health systems strengthening. Those are important components in strengthening our healthcare systems and in making sure that our people have accessible health. I cannot emphasize the accessible health enough, because that is what we need, especially as Africa, if we are moving towards universal health coverage. There's no way that we can reach universal health coverage without having accessible healthcare to, or for our people. So what I'm saying is, Paul Kagame's or President Paul Kagame's notion of having our mRNA vaccine plant in Africa is putting us at a better advantage for us to be able to then bridge this gap and maybe not have this gap entirely at some point. So the support of our own as Africans is important. When one of our own comes up with a brilliant idea. Yes.
Yes, we can hear you. You should continue.
Oh, okay. No problem. Yes, in closing, I was saying that when one of our own as Africans comes up with a solution, it is important for us to rally behind them and to support them and to also bring in our own ideas. I again go back to the fact that our ideas, our opinions are very, very valid. And let us not be too dependent on the governments to change things for us. In fact, the governments are working for the people. We tend to forget that, and we take what governments say or what governments give us at face value without challenging those things. Governments are working for us. As the people on the ground, we are the ones that put governments into leadership. Therefore, when we see that things are not going the way they should be going, or we are not being served as we should be served as people, especially when it comes to the healthcare system, then it is our responsibility to then come back and say, whether we are forming commissions, whether we are forming committees, the important thing is not to just form committees that are going to have a name and sit in our little corners in our boardrooms. The important thing is to form commissions that are going to challenge the status quo and that are going to continuously advocate for the healthcare system and for the equitable access to healthcare for our people. Thank you.
Hello.
Hello, we can hear you. You can go ahead. We can hear you.
We can hear you.
Okay, thank you. I have observed that this has been full of a lot of passion, a lot of emotion. This is really an intriguing topic, and I want to appreciate the comments that are going on in the chat. First of all, I can see some participants are really interested in the topic. Some of them are asking recording. It shows that African youth are becoming more and more interested about shaping a new order of public health, and this is really impressive. I just wanted to comment before jumping into my intervention. So we are talking about how to adjust one advocacy strategy and tactics. For this, I want to say that as youth, I think we should lead by example. I just want to be straightforward. One way to adjust one advocacy strategy as youth is that we should lead by example. What do I mean by leading by example? When you are talking about vaccine inequity, if you are vaccinated today, the easy way to go about it is to inform your friends, your colleagues that you're vaccinated. You can even post your vaccination card on your statue just to raise awareness. People who are misinformed will start asking themselves to you that, why have you vaccinated? Are you not afraid? And you inform them, you educate them. These are small actions that can change advocacy by leading by example. Then how to ensure a vaccine equity gap addressed? I think the only way youth can have a role to play is by is by promoting, because even the little vaccine that we're already having in our various countries that the Minister of Health have tried to work on, we can promote information. We can promote information, tell them that the vaccines are available, even give them the district hospital where they can get the vaccine. I think we have a key role in health literacy again when it comes to vaccine inequity. Because when you want to go to talking about the politics, I am not sure that it's the youth that decide how many vaccines are going to enter a country or not. I'm not sure. What we can do is to promote the literacy, inform our population that the vaccines are available, tell them the importance of getting vaccinated. And of course, if possible, when youth are being consulted for the decision-making related to the vaccine, they can give their opinion, they can insist on the fact that the pediatric population, the adolescent population should not be left behind. And these are the few things that we can do. And this is just to wrap up. And I think that's how I see how vaccine equity can be addressed from a youth perspective.
Thanks very much for those contributions it's been such a fantastic discussion. I'm just going to give Ahmed an opportunity to speak, and then Mohammed, and then we'd head off to Q&A session.
Yeah, thank you. I think I don't have much to add in after my colleagues added, but I just want to highlight one of the themes I read regarding this vaccination, COVID-19 vaccination, and in terms of inequality. This theme or the statement said that no one is safe until everyone is safe. So it doesn't make sense if like a country that vaccinated all the people and then opened the airport and then people from another country come. So I don't know, but as mentioned before, there's many political issues today. And according to this WHO efforts and the COVAX, the strategy to achieve that, I think in mid of 2022, to vaccinate 40% of population of every country and 70% of a middle of 2022. I think many countries exceed this percentage and other countries still no. So hopefully that we need as a youth to, in terms of advocacy, to showcase our needs, to again convince the policymakers to communicate with this African Vaccine Acquisition Trust, this AVAT. I think we need to at least, if we don't have actions to take, we still have voices. It should be heard. Thank you.
Yes, so in addition to what everyone mentioned, I guess like a very important thing that we need to focus on is like the global health governance in general. Like, because like what we can do in our communities, this is what we all have mentioned, and it's also important that we get to see what countries can do together, what decision makers can do together. The problem is at the moment that the lack of solidarity and the lack of cooperation between the different countries, between high-income countries and low-income countries, between developed countries and developing countries. We're just seeing many countries working together, and even sometimes some of them are now like giving booster doses, while other countries did not even, like many people did not even get their first dose, which is very unfair and very unequitable. And like one thing that we really need to focus on in terms of the global health governance is the pandemic treaty that like they wanted to work on after adopting the resolution in the WHO special session last month. So it's very much important that in order to be prepared for next pandemic and even be prepared for the next steps in this pandemic, we need to make sure that the equity that we are focusing on is also done on the higher levels, on the global governance levels, in which countries can like provide the technologies, provide the data, provide the vaccines, provide everything to lower income countries in order to ensure that everyone is safe, as Ahmed mentioned. And like one thing that is very important is also the private sector. Because like one of the reasons why there is vaccine inequity at the moment, we remember when India and South Africa asked for the TRIPS waiver in order to get the intellectual property and be able to work on the vaccination in their own countries. And many countries and pharmaceutical companies said no to the TRIPS waiver, said no to like sharing information, sharing technologies. This is an issue. Like this is something that we need to work on, and we need to ensure that pharmaceutical companies are not getting involved and jeopardizing the health of the people in the process. And this is actually like, I remember also, for example, like past years when they made the Framework Convention on Tobacco Control. When they did this convention, they excluded the tobacco companies because it's not realistic to include the companies that would put their benefit and put their economy and put their income at the higher level than the health, and then ask them, okay, do the vaccine equity and work on the TRIPS waiver, because like logically speaking, they will say no. So it's very much important to identify who are the stakeholders who need to be involved in decision making and who do not need to be involved. And it's very much important to work on our like resolutions, our documents that guide the global health governance in order to make sure that vaccine equity is something that we can actually achieve and not just call for without having realistic plans to achieve it. Thank you.
Thank you very much for your contributions, and to all the panelists on this section. I think it's really been a brilliant discussion, and I think it really got heated up in some segments and really lit up discussing such a, I think, a topic that's really close to everyone, being that of equity. I'm going to hand over to Mary Claire, co-moderator, to do the Q&A session, and that will be followed by concluding remarks from each speaker. Thanks.
Thank you so much, Kapil, for that. I mean, I think the best way to end the session is to end the session on a radical note, and ensuring that we stimulate some thought-provoking processes and ensure that we have a future of our healthcare systems, and really need to be passionate of the messages that we say towards people. I've seen a really interesting comment, actually, before I jump into the Q&A, but I'll say it in a little bit. But the first question, I think, came for Ahmed. Question was, in your opinion, how do we speedily shift to update our curriculums to integrate digital health? That was the first question.
Okay, Mary, thank you for this question. I think before we think how can we change the curriculum, we need to think, do we need to change the curriculum or no? So this is very important, because changing curriculum is something like a process. It's not just like action. It's a process. I think this question asked when we discussed the digital health. So in terms of changing curriculum, with the changing time, curriculum should also change to reflect the needs and aspirations of the people and the community and the healthcare needs. There's no like a uniform curriculum for all countries. Like, for example, if we speak about the 54 African countries, we cannot say that we can make a uniform curriculum for all. The curriculum content itself should be based on the current information, not on the past or not on other countries. It doesn't make sense to take a curriculum from other country and give it like a copy paste to your students to read. It doesn't make sense if I take the curriculum of US in terms of digital health and teach it in any African countries, because we don't have the same infrastructure, we don't have the same equipments, we don't have the same system, we don't have the same competences and the healthcare workforce. So how can we change the curriculum? We need to follow some process. And the first process is meet with the stakeholders. The stakeholders here, not only the professors, not only the academic staff, it should be all the healthcare professionals. So we need to involve the students, we need to involve the academic staff, we need to involve the clinicians, we need to involve the hospital managers, leaders, supervisors, to identify the current situation of the health system now. And at this time, if we identify the current situation of the healthcare system, we can identify the gap. And then the next stage after identifying the gap, how can we fulfill this gap through the curriculum? And we need the next stage, we need to choose the appropriate way to teach. So the modern teaching strategies, we have many issues. We have clinical reasoning, for example. We have evidence-based practice, we have patient-centered care curriculum. We need to set our curriculum to be based on the competences. So this is the delivery of curriculum. And the last stage of that process is to evaluate, and it should be continuously evaluated. And then we will change it again, because if we identify the current situation, we will identify some gaps, because there is many progress year after year. So hopefully that I answered that.
Thank you so much. Thanks a lot, Ahmed, for that stellar response. I couldn't have answered it any better. I think you've done that question quite some justice. I would like those of us who are currently watching this session live, if you'd like to ask a question live, you could raise your hand and I could give you the floor to ask the question, because we are on our final question that has been asked by, the question is, how can I be a member of AHO? So I'm not really sure whether it was AHO you're asking or AfroPHC. But with regards to AfroPHC, it's relatively an easy process to be a member. I will be posting the link in the chat in a few. So it's just essentially signing up to be part of our mailing list, and then you get to know updates on what's happening in the organization. And then every year around April, May, we have our call for elections for officials. And now we have established this youth hub, which will be focusing on youth activities on primary healthcare within the region. So yes, it's essentially quite simple, but I will also leave my email in the chat box in case you want to ask any more questions on the same. And actually, I'm happy to say actually 90% of the people who have been panelists in this session are actually part of the Youth Hub as coordinators. So we're doing well so far, but we really need more hands on deck. So karibu nyote to join the Youth Hub. Welcome everyone. And I do not see any raised hand. So I think we can now wrap up the session, because we are 5 minutes past time. So probably we will now go to the last segment of the discussion. And the last segment essentially is more or less, we wrap up the way we started with a fireside presentation. I'd like us to maintain time, and I'd like to give each of our speakers about 1, maximum 2 minutes to just tell us their key message that will empower youth advocates in not only the Africa region, but globally, on how to be better youth advocates. Probably if you have something that works for you, you could share that. And we can just call this a day. So I think I will start off with Mohammed, and then we can just take it from there.
Yes, thank you so much. So from my side, I believe, like, as a youth and as an advocate and as someone who's very passionate about global health, my message would be, let's empower ourselves and let's educate ourselves about what we're advocating for. And let's make sure that we can identify our strength point and even identify our weaknesses and work on them in order to be able to be the advocates that we really want. If we cannot see the people around us in terms of the decision makers or other stakeholders, if we can't see them doing their best, we need to, as I mentioned earlier, we need to lead by example and show them how to advocate and show them how we can lead and how we can do the change. This is very much important. I believe advocacy is the key. I believe the grassroots lobbying and raising the awareness and educating the communities is the key, because once people know their rights, it's very much beneficial and very much impactful that they ask for their own rights. This is very much important. And finally, I would say that health equity is very much something we all want to achieve. Africa, in comparison with with the other regions, is suffering, I would say, from unfairness and lack of equity with other communities and with other regions, despite that health should be the right for everyone and not a privilege depending on your socioeconomic situation or any other determinant of health. So it's very much important to reflect on what we are living, to reflect on the lessons learned from the COVID-19 pandemic, to reflect on what we have experienced during this period and even normal circumstances, and identify what we need to do next and how we can engage everyone in order to ensure meaningful engagement by all stakeholders in order to ensure a healthier region, not just in terms of Africa, but also a healthier community in terms of the whole world, because everyone deserves to be healthy, because as I mentioned, health is a human right. It's just a basic human right for everyone. Thank you.
Excuse me, I just want to say, thanks, Muhammad, for that. I totally agree with you. In less than 1 minute, I just want to say, if you stop breeding, you stop bleeding. If you want to take the lead now as a youth, as a young healthcare professional, you have to read. Read means don't just like reading some books, but read to be engaged, network, and be updated and networking with others within local level, national level, and even globally. Think globally and act locally in your community. And if you don't face any challenges, so I think you are not in on the right way of developing and leading, because if you want to lead something and change, you will face many resistance and challenges. And at this moment, you are in the right way. So please don't think that as a youth, don't think that you will wait, you have to wait to be after graduated to take the lead. No, we are the presence, not only the future. Thank you.
Yes, I guess I go next after Ahmed. This very sober person. Yeah. A very important part for me, the campaigns and initiatives and the things that I push for is recognizing that health is a very personal thing. Health is a personal thing to people. And every time in the campaigns and stuff, one of the most important stuff is that as much as possible, we need to put health in the hands of the people. Health has to be, everybody needs to be able to access services and stuff, at least in part, within their hands. And activating conversations with how to best use and align community health volunteers, activating the best ways to use the public health professionals as community guiders and people who would help us at the community level in prevention of this healthcare is definitely one of the ways to ensure that healthcare is in the hands of the people. So every time we are having conversations and every time we are talking about governance and talking about political processes, talking about treaties and agreements between countries, most conversations, how do you take that conversation to the level of everyone to be able to access? Because health is very important. People die in their houses because they can't access healthcare, or because they Googled and got a wrong information. And the ability to bring this information into the hands of the people, healthcare being in the hands of the people, is a very important concept and aspect in public healthcare. And I hope to hear some more ideas later on in the course of this conference, and also just having some other tete-a-tete with my colleagues from AfroPHC, and how best we can continuously better some of these ideas. Thank you very much, and I'm glad to be here. Asanteni sana.
Okay, as a closing statement.
All right,
You're mute.
so for me, I would like to end off with highlighting the fact that it is such a privilege to be a young African in these times. to be able to advocate for universal health coverage, and to be within the healthcare system. It is an honor. It is such a privilege. I think for me, let us support each other as young people, as Africans. Let us not doubt the fact that our levels of education and the times that we have spent in getting these degrees or diplomas, those times were not in vain. Let us not take everything at face value. It is okay to ask questions. It is okay to challenge the status quo. However, let us also remember that we cannot implement things because we think they are valid. We need proper research, scientific research, especially in the healthcare system, in order to assist us to make evidence-based decisions for the best of our people. So I would like to urge the young people of Africa to trust the research that has been done, especially when it comes to the efficiency and the effectiveness of the COVID-19 vaccines, because it is a pandemic and it is important for us to work together. Scientific research, as myself, I am a researcher currently. Scientific research is a very broad spectrum, and unfortunately, we cannot always explain the nitty-gritties of how decisions are made. However, we have statutory bodies and regulatory bodies who are there to ensure that every medication that is taken by the people is safe, is effective, and it is for the better of the entire continent and the entire world, especially when it comes to COVID-19. And lastly, I would like to urge us to start thinking out of the box. Education is important, and unfortunately, it's not everything that we need that will get in the education system. So I would like to encourage us, especially students out there, to not only stick to just the academic content, but to watch webinars like these, like that have been hosted today, and to also look for other, parties and other commissions and committees that are in line with the healthcare system and provision of health, and for us to incline ourselves beyond just our academic and curriculum knowledge. Thank you so much once again for having me today. It was a great pleasure being here.
Okay, thank you, everyone. It's really nice that we are finally coming to the end of this discussion. And my message for you, the Youth Africa for Tomorrow, is that first, we have learned that digital health has come to stay. Africa youth in healthcare could make use of technology for health literacy and personalized medicine with the advent of COVID-19. Misinformation and delays in coming to the hospital. We have also learned that no one is safe until everyone is safe. Youth should emphasize on health literacy, on vaccination to curb misinformation and promote vaccination of our population. And lastly, this is my own take home, and this is what I have for you, the youth. We can reach equity in vaccination without equity in vaccination education. African youth can no more be spectators, but we should champion this. And it's time to get out of the box. You are the future. Thank you.
Amazing. So I'm guessing it's my turn now. Thank you. Okay, so I actually want to thank everyone for the opportunity to have spoken here today and to have learned from each and every one of you. My message to everyone is, even as we continue on this journey, we should remember that everyone has a role to play, and no health worker, no profession is an island. We've already taken some of the most important steps. As Tracy Chapman would say, the revolution starts with a whisper. So it has gone from an idea to a whisper. Now we're having the discussion. So after discussion, the next stage is plan and action. So we should not lie there at this discussion. We should also make a planned action. And yep, that is my message to everyone. And also, please, let's avoid violence. And as we try to share our messages with everyone. We should avoid violence. Thank you.
Thanks very much. Alois, do you want to give any concluding remarks briefly?
Yes, thank you very much for this opportunity. I'm sorry I was speaking to someone else here close. I really appreciate this opportunity. Thank you very much, Dr. Marie. Thank you very much, Kapil, for moderating this very important session for African youth. And thank you everybody for the wonderful speeches you've given. And I'm hoping that it's time for young people in Africa to move from these discussions to actions, because we really have a lot of potentials within us. We really have a lot of things to deliver to our community to improve health outcomes. When we're talking about health of the people, we go to references on the statistics, but these statistics are not just numbers. These are lives of people. So as young people, we have a great chance to save these people. We have a great chance to improve lives of many, and including the lives of our own fellow youths. We have a lot of issues as young people, from the adolescents and the adults. We have issues of mental health. We have a lot of diseases in Africa that we really need to combat in order to live a peaceful and stable life. So I'm looking forward to collaborate with everyone in this field of health to ensure that we build better lives for today and the future. Thank you very much, and congratulations for the great session.
Thank you, Alois, and thanks to each and every one of our panelists, co-moderator, MC, and for our attendees for really, being a fantastic audience here. I'm just blown away by the level of the conversation here. As a fellow youth, I can say not only do we have hope, but we have leadership in the future of Africa. The conversations were really deep, intriguing, dynamic, and I don't want this to just end here, but let's take it to social media, let's take it to Twitter, let's work on a collaborative piece or document together. Really fantastic and phenomenal discussion and amazing caliber of speakers here. So thanks to each and every one of you. From AfroPHC side, we are really impressed and honored to have had you on board. And let's keep the discussion going. Over to you, MC, for final remarks, and we'll close the session. Thanks.
Thank you, Kapil. Gosh, time flies when you're discussing great things. I mean, we started this session off at 7:30 in the morning. We're now at 10:50 a.m. I think for us, this started out as an idea and it's coming to actualization. And I'd like to thank all the amazing team at the AfroPHC Youth Hub for actualizing it, and especially our amazing speakers. They've really given us thought-provoking insights on our role in primary healthcare strengthening, especially in the African region. This is not the end of this discussion. AfroPHC Youth Hub will be engaging more, especially coming into 2022. But as Kapil has said, this conversation is not over now. I want all of us who've attended today to continue the conversation using the hashtag AfroPHCYouth, hashtag CPHIA 2021, and you could also include hashtag Youth4UHC. This conference is still ongoing. Actually, the main sessions are starting out in about 10 minutes time. That's 11 a.m. East Africa time via the links I shared out earlier. And actually today's discussions are actually focusing on vaccine equity and health system strengthening in the Africa region. So if you'd like to now carry on the discussion from what we've discussed this early morning towards your day, please feel free to tune in. And from us, we'd like to say thank you. And we hope to see you at our next event. Have a lovely day ahead. And for those of the participants who would like certification, we will be sorting you out. But if you'd like any additional material, you could always email us on the email that you got from the Zoom invitation from. So thank you so much, and do have a lovely day ahead. Remember, nothing without us, without us. So yeah.